Hello students, today I will be talking about salivary glands. In the introduction part, first of all, salivary gland is an exocrine gland which secretes its secretions, which is called as saliva, which is present in the oral cavity. These salivary glands are classified as major salivary glands and minor salivary glands. So among the salivary glands, you get three pair of major salivary glands and numerous minor salivary glands. The major and minor salivary glands put together, basically histologically, if you look at it, the epithelial component of the glandular tissue is called as parenchyma. So the parenchymal tissue is the epithelium is derived from the oral ectoderm. Okay, whereas the connective tissue comprising of fibers, collagen bundles, inflammatory cells and ectomesenchymal cells, all of these are present in and around these epithelial cells, supporting them, like they help them to form a capsule around the gland, and they also help in splitting the gland into lobes and lobules. So the purpose of dividing the gland into lobe and lobules is to better serve them with blood vessels and nerve supply. Okay, so that is done by the connective tissue. So connective tissue is basically supportive in nature, whereas the most functional part of the gland is the acinar component, that is the parenchymal component. And because the gland's name is salivary gland, it is involved in the production of an important secretion called saliva. So saliva basically, just now as I mentioned, it is a secretion from the salivary gland. Saliva is a layer of coating that is present in the oral cavity. It is always present. What does it cover? It covers both the soft tissues and hard tissues. So the saliva reaches the oral cavity, and oral cavity, what do we have? We have both hard tissues and soft tissues. So there is a continuous coating of saliva on the inner surfaces of the oral cavity. It is basically, it's not a pure fluid. Once it reaches the oral cavity, it becomes a complex fluid because it is made up of salivary secretions. All secretions basically are proteinaceous in nature, a kind of a protein. Along with that, you have organic and inorganic substances. When you look at the composition of saliva, you will realize that there are a variety of components that are present in the saliva. Hence, it is called as a complex fluid because it is made up of many things. The saliva is basically a mixture of two types of secretion: serous secretion, which is basically watery in nature, and mucus secretion, which is basically a thick viscous secretion. Around 750 ml of saliva is secreted per day. In this, around 60% of the secretion comes from the submandibular salivary glands, and 30% from the parotid gland, and 5% from sublingual salivary glands. And the remainder of small portion of 7% comes from the totally put together all the minor salivary glands inside the oral cavity. It is a saliva is a secretion that is present inside a body cavity, that is the oral cavity. So it should be in and around neutrality. So pH of the saliva is 6.7 to 7.4. Most of the body fluids usually tends to be around isotonicity until and unless there is an exception. Composition, it's made up of water 99%. The remainder 1% is made up of both organic, inorganic, serum constituents and healing components. What are the inorganic components that are present? Inorganic, when we say inorganic, we basically speak about ions, uh, the chemicals that are present. So mainly sodium, potassium, chlorine, bicarbonate, and small amounts of calcium, magnesium, iodide, and fluoride as well. So all these are important components, inorganic components of salivary secretion. Organic ions, secretory proteins, carbohydrate rich glycoproteins or mucins, and antibacterial substances. So as I already told you, that secretions basically will be a type of protein. So secretory proteins are basically carbohydrate rich glycoproteins, that is especially if it is a mucus secretion, and antibacterial substances such as in serous secretion, it is watery in nature and it usually confers the antibacterial properties. Okay. So serum constituents like albumin, blood clotting factors, beta 2 microglobulin, and immunoglobulins are also present. So that's how they say that because of all these healing properties, factors of healing, it is thought that all oral lesions tend to heal at a very faster rate because they are constantly coated with a layer of saliva. Functions of saliva. Now I am going to mix up the composition of the saliva, the component of the saliva, and the function it does and how it is going to be beneficial to the oral cavity. Okay. So first of all, functions of saliva: protective function, buffering action, digestive function, required for taste perception, antimicrobial action, that is defense purposes, and maintenance of tooth integrity. Okay. So functions of saliva is something that you have to know and answer. Questions will be asked both oral and written right from first year till the final year. So, so this is what I was saying. I'm going to give you a I'm going to give you a combined effect of function, effect, and what is the component of the saliva which is playing the role. In protective function, first is lubrication. Just now I mentioned carbohydrate. Carbohydrate, the nature of carbohydrate, we know that it is thick and viscous in nature. Basically a sticky kind of substance. So this sticky kind of substance helps in providing lubrication, just like in machineries and oils. When substances have to work together, when two or three things have to work together in uniformity, lubricating oil basically helps in reducing the friction that is present. Now, same thing, you apply it into the oral cavity. Every time you try to swallow, every time we achieve an occlusion, teeth to teeth come in contact. Both are hard tissue surfaces. Every time they bang against each other, it is very possible to create a friction. So the saliva that is present nullifies the effect by lubricating properly. Waterproofing, same thing. The sticky surface of the saliva is going to make the surface of the oral mucosa waterproofed. For example, if a floor is wet and we try to walk, there is a lot of chance that we can slip on the floor. Similarly, when the microorganisms try to attach themselves to oral mucosa, they have to attach to a surface onto this on a surface much before they can execute their disease process. So as long as they cannot habitat, as long as they cannot colonize, they will not be able to bring about the disease process. Okay. So this waterproofing effect prevents the bacteria from attaching themselves onto the tooth or onto the oral mucosa. Lavage, same thing. Whatever is not been able to, whatever microorganisms which were unable to attach themselves are converted into lavage and it is swallowed down inside. Pellicle formation. Pellicle formation is a layer of protein that usually forms onto the hard surface, that is the tooth surface. It tends to coat the surfaces of the tooth. So pellicle is good for the tooth because it determines the entry of substances in and out of the tooth substance. For example, continuous mineralization of enamel. That is quaternary mineralization which we say. That is the outermost layer of enamel being the hardest. Outermost surface, the enamel being the hardest surface. It's very important to have that, and it is possible only because of the pellicle formation. So as I told you, it is brought about by the component glycoprotein and water. Okay, these two put together will help in the protective function of lubrication, waterproofing, lavage, and pellicle formation. Okay, buffering function. Buffering, we know that it is maintained, buffering deals with maintenance of pH. So because we are talking about a body fluid, it is very essential that the pH has to be neutral. I just mentioned it a while ago. So this isotonicity or neutral pH is going to be achieved with the presence of important elements such as phosphate and bicarbonates. Every sip of drink that is taken, of tea, coffee, or any beverage that you drink, any food that is eaten, there is release of carbohydrate, and we know that part. And digestion of carbohydrate starts from oral cavity. Okay, so once this happens, as soon as the carbohydrate is digested, the pH of the saliva falls down because there is an acid formed. So the minute the pH drops down, the body tries to make an attempt so that the pH can be raised up and again brought back to neutrality so that it can maintain the pH. So this pH maintenance, what does it help in? It makes the environment unsuitable for colonization. For example, bacteria, if they need to attach themselves onto a surface, they thrive on an acidic environment. So, if we do not give them that acidic environment, there cannot be a growth of bacteria in the oral cavity. So, by maintaining pH, we are in a way trying to avoid the colonization of bacteria. At the same time, I told you every sip of morsel of food that is being taken inside can be converted into an acid because it will contain carbohydrate. It is converted to acid. The minute there is acid, the acid will be neutralized by phosphates and especially bicarbonates, HCO3 minus. So this is going to bind with the acid, H plus ions in the acid, and bring about neutralization. So that is the buffering action, both of which are aimed at maintaining the pH at isotonicity. Digestive function. First of all, in the digestive function, you need to start with the process of food. Food first reaches the oral cavity where the food is going to be mixed with saliva and it is going to be chewed. By occlusion, it's going to be masticated and converted into a bolus. You cannot imagine putting a food into mouth and directly trying to swallow it. It is not the way that it goes. It needs to be chewed, converted into bolus so that it can be slipped back into the oropharynx area. So bolus formation is the first step for digestion, and that is brought about by water. We know saliva is predominantly made up of water. So the water in the saliva helps in conversion of or formation of a bolus. At the same time, every time we swallow numerous amounts of times in a day. Every time we occlude, we tend to swallow. With this, the saliva is passed down into the esophagus so that it reaches the stomach. So the nasopharyngeal esophageal contents, the acid which could escape into the esophagus from the stomach tends to get neutralized. So this becomes similar to the buffering effect that we spoke about. So the elements also are going to be phosphates and bicarbonates, which bring about neutralization of the esophageal contents, which tend to be acidic in nature. Digestion, I told you, part of the digestion of food starts in the oral cavity. The actual digestion is meant in the intestine and stomach and all that. But the digestion process basically starts in the oral cavity. Two components, basically carbohydrates, amylase. Any name that ends with A is basically is an enzyme. Amylase is an enzyme that is going to act on the carbohydrate component, amyloid kind of material. So it digests the starch. Part of the digestion of fat also starts inside the oral cavity. For that, you need to have an enzyme, lipase. Lipase enzyme is needed for that. Okay. So taste, a very important property of the oral cavity, which a very important special sense of the body, which can be performed only in the oral cavity. You cannot understand the taste of the food by looking at it, by smelling it, by touching it. You can understand the taste only when it reaches the oral cavity. And what an oral cavity helps in that taste perception? It is the taste buds that are present that is going to help in understanding the taste of the food. Okay, for that to happen, first of all, the food molecules that has been placed inside the oral cavity should be wetted and dissolved in the saliva. That is, the water component in the saliva soaks the food substances. So once that happens, only then the taste is released, and that will be able to pick up by the taste buds, the pores, the taste pores which are present inside the taste bud, the receptors around it usually pick it up in the solution format. So water helps in this process. The next is the taste bud growth and maturation. Taste buds are the structures that are present on the surface of the tongue that is cleansed every day in the morning. The small granular structure that is present on the dorsal surface of the tongue, to be particular, they are the taste buds. And the taste bud growth and maturation is dictated by an important protein called gustin. So you must have heard in after a fever, you feel that the mouth has lost its taste because of the fever effect. The taste buds would have decreased in numbers, hence you will not be able to understand the taste. Similarly, in old age, the number of taste bud as an aging process along with all cells, even the cells of taste bud also decrease. So there also you hear the complaint that taste is not there in food materials. Again, allow regeneration, allow vitamin E prescriptions, vitamin A prescriptions. This is going to bring about the growth of gustin, which will help in taste bud growth and maturation. The next important property of the oral cavity is antibacterial function. The amount of microorganisms present inside the oral cavity is umpteen. Too much, too many microorganisms are going to be present in the oral cavity without being able to causing a disease process. Everything that reaches the oral cavity will carry some amount of microorganisms in them, most of which are not capable of causing any disease process, because as I've already told, there are a lot of barrier effects which prevent the microorganisms from attaching onto the oral mucosa, so that you can. Let's imagine that for some reason those physical barriers were passed on. That is, the waterproofing effect, the lubrication was missing, and the bacteria have finally managed to attach themselves into a surface area. Let's say a tooth surface or a oral mucosal surface. Then what to do? Even then, the saliva is capable of handling these bacteria by the antibacterial substances that are present inside it. First of all, it creates the physical barrier effect, just like I told you in the first part, right? So the waterproofing and the barrier effect there. So the glycoprotein component of the saliva will create a physical barrier preventing the microorganisms, or creating a slippery surface for the microorganisms so that they do not attach themselves onto the oral mucosa. As I mentioned, for some reason, if they have managed to skip this, if they have managed to skip this, even then it is capable of handling it. That is because the antibacterial substances such as the antibodies, salivary antibodies, are present, especially the important antibody IgA, which is present in secretions, which is known as secretory IgA, SIgA. So that is present abundantly in all body fluids, including saliva. So this secretory immunoglobulin A will play a very important role. So how does an antibody act? It recognizes an antigen, which is the bacteria now. Antibody comes and attaches to the antigens, which is a bacteria, and opsonizes it, engulfs it, and kills it. So it's a direct effect. Okay, antibodies directly tackle the antigen, which happens to be the bacteria. In other ways also, indirectly also, the saliva helps in controlling the bacteria by creating a hostile environment. Saliva is rich in enzymes such as lysozyme. Lysozyme is an antibacterial substance which is known to destroy or break the integrity of the cell wall of the bacteria. So once the cell wall of the bacteria is damaged, the contents of the bacteria pour out and it kind of dies. So it's not a direct kill, it's kind of a indirect kill. It dies. Lactoferrin. Again, lactoferrin is an enzyme that is required by both the bacteria as well as the oral cavity. So oral cavity will not give the bacteria the lactoferrin. So what happens? This bacteria, even though they have attached, they need to grow first. They need to colonize. They need to increase in their growth. Only then execute the disease. So they will find it very difficult to proliferate and mature and grow, multiply themselves, because there isn't enough nutrition for them. So then also it's a kind of a control process where we subside the growth of the microorganisms. Okay, so antibacterial property of saliva, very important. First is the physical barrier effect, just physical barrier effect brought about by the glycoproteins. Then through antibodies, salivary antibodies, that is secretory IgA, SIgA, or with through lysozymes and lactoferrin, creating an hostile environment which is going to make it difficult for the growth and multiplication of the microorganisms. The last one is maintenance of tooth integrity. Okay, maintaining the integrity of the tooth. Tooth is an important component of the oral cavity. The contents of the oral cavity can be divided into hard tissues and soft tissues. In the hard tissue, we have the tooth that is exposed into the oral cavity. The jaw bones are covered by the oral mucosa, but the exposed hard tissue component is the tooth surface. So maintaining its integrity is very, very important. Again, every food that is ingested, that is put inside the mouth, will contain some amount of carbohydrate inside them, and the bacteria present uses this carbohydrates and converts them into an acid. Okay, an acid is produced. This acid makes the pH of the saliva drop. The minute there is a drop in the pH of the saliva, calcium in the tooth tends to migrate. So it is the acid that is present is capable of removing the calcium from the tooth surface. This is happening on a day-to-day basis. Not that it has removed all the calcium from tooth, but definitely there is a continuous effort in removing the calcium from the tooth surface. That is why it is advised that after every drink, after every food intake that is there, mouth has to be gargled and squashed nicely so that all the acidic acid that was produced can be removed, and we can minimize the chance of removal of calcium from the tooth surface. Okay, at the same time, whatever calcium has been removed from the tooth will be inside the saliva. So the minute the bicarbonates and all present elevate the temperature, elevate the pH towards isotonicity, the saliva, the calcium present in the saliva will be redeposited back onto the enamel surface. So that also happens. Okay, so enamel maturation, you see a lot of ads on the TV saying that this paste makes the tooth stronger. How does it make it stronger? Because they need to cross the surface. I told you, quaternary mineralization, the quaternary mineralization, that is limited to the surface of the superficial surface of the enamel, which happens to be the hardest part of enamel. And the transfer of these elements is possible because of the coating of salivary proteins, pellicle, I told you. Enamel maturation, repair. And for this, for anything related to what is tooth made up of? Calcium and phosphate. So you need calcium and phosphate to heal the tooth and to bring about maturation about the tooth. So how is saliva basically formed? Saliva is basically a component, as we just saw, it's a complex fluid. The saliva is made up of a secretory component, that is the acinar cells, which are basically epithelial cells arising from the ectoderm. Okay, so this acinar cells will secrete the salivary proteins. The salivary proteins will be transported from the acinar cells after their production through a ductal system. So in this ductal system, there will be addition and removal of substances along with addition of water. Okay, so that's how the saliva is going to be formed. Okay, so first stage, primarily saliva is produced by the acinar cells, which are present in the secretory end piece, and sometimes, very rarely, in the starting part of intercalated duct. Isotonic saliva basically contains organic components and water. The secondary stage, that is when saliva moves from the secretory end piece into the ductal system, then modification of saliva occurs where there is secretion and reabsorption of important components inside the saliva, such as sodium is going to be deposited, removal of potassium takes place, bicarbonates are added. So many things tend to occur in this. Okay, so this way there is lot of water that is added into the saliva. So the modification of saliva importantly takes place in the primary saliva and secretory, in striated duct as well as in excretory duct. So you can observe this in the diagram. I've tried to show you a small concised version. Okay. See, this is the acinar component of the cells and this is the ductal component. So the acinar component or the terminal secretory end piece, they are the ones that are responsible for secretion of proteins. So once proteins is secreted, some amount of water and electrolytes are added. This primary saliva will be isotonic in nature. Okay. So once the saliva passes through the ductal system, lot of substances will be secreted and reabsorbed, such as potassium. If it is added, sodium will move out of the cell. So the minute sodium moves out of the cell actively, potassium is pumped actively into the ductal area in the striated duct. Following this response, sodium will be actively pumped outside the cell. As soon as the sodium is actively moving out of the cell, chloride is an element which cannot stay without it. So chloride will passively move out by itself. Similarly, H plus, when it enters actively, passively bicarbonate ion also enter inside. Okay, so NaCl gets reabsorbed, so automatically lot of fluid will be added into the saliva, making it a hypotonic solution. By the time it reaches the oral cavity, it will be a hypotonic solution. The functions of saliva, again, it's a very important one. Functions I have told you. This saliva is used for a lot of diagnostic processes. Okay, it may be a little outside the purview of your this thing, but there's no harm in knowing any advancement. Diagnostic aid of saliva. First of all, to detect oral diseases such as caries. There are a lot of caries activity tests. By looking at the saliva of a person, we can predict how susceptible he is to dental caries. Is it very susceptible? Is he very less susceptible? This can be detected by the diagnostician, that is the dentist. Thereby, we can successfully plan how to manage this treatment. For example, if a patient is highly susceptible to caries, then we are going to call him every weekend or once in a month, depending upon the need. Try to give them fluoride therapy, try to use fissures and sealants. So many things that can be done so that we can avoid caries in these people. Similarly, candidiasis, we can also detect candidiasis with the saliva. Clinical problems, such as you must have seen, a lot of misuse of drugs that takes place, like marijuana and steroids that have been consumed. Okay, usually they go for a blood test so that they can try to assess. Nowadays, in order to avoid pricking, because drawing of blood is a what do you say, is an invasive process which is not acceptable by all. Many of them fear needles, they don't like it. Cooperation is very less with those techniques. Hence there is an alternative method that is available, and saliva can replace blood. Whatever tests that can be done using blood can be done using saliva. So most of the places you can replace it. So even in a simple setup, you will be able to assess them. So as I just mentioned, clinical problems such as psychological problems, smoking, poisoning, most of this can be detected using the saliva. Systemic diseases like Sjogren syndrome, just collect the flow of the saliva. If the flow of the saliva, see, I said 760 ml, we cannot wait for the whole day, right? So wait for 5 minutes. There are Lashley cups, small cups, just like um, artificial eye colors, na? Just like that. You will get small cups. You place it at the opening of the ducts that are present and try to collect the saliva into it and measure it. If the production of saliva is less, then it will indicate that there is a disease process occurring in the salivary glands, giving rise to reduction in the saliva. So that usually is associated with autoimmunity. So Sjogren syndrome is one example. Cystic fibrosis is one more condition where you can expect the damage of the salivary glands. Steroid hormone detection in athletes and in gym and in a lot of places, misuse of steroids can be detected by using the saliva. Monitoring of drugs such as phenytoin, carbamazepine, and theophylline. Most of them are psychological drugs, and they are used for controlling fits. Okay, so in those people, if you want to track whether they're actually taking the medicines correctly on time, because it is associated with a lot of side effects, so many patients tend to miss the course of drug. So with the more continuous monitoring using saliva, it is very possible to know the drug usage, detection of marijuana, banned substances that are present can be easily detected using just saliva without having to draw the blood of the patients. Okay, so saliva is a very, very important question. As I told you, composition of saliva, functions of saliva, diagnostic implications of saliva, all these things happen to be of great importance towards theory as well as viva. There is a lot of questions that will be asked. Thank you.